So let's talk TENS unit or stem pads for your shoulder. The whole idea is that for the TENS unit, it is to help decrease pain. You can use it for rehab, but in our instance, we want to decrease pain, decrease inflammation, get the nerve to calm down, just kind of make it feel better. And so there's a lot of at-home units. We have a system in here that's a little bit stronger, but it has all different settings. And so a lot of people ask me, how do I use it? Where do I use it? What do I do with it? So there's so many different versions, but the idea is that for a numbing type of sensation, like we usually using this at home when we're in pain or if there's a lot of inflammation. So we are going to use this at usually about 100% constant, which just means the sensation just comes consistently. You don't want it to ramp it up and down. You usually can do that if you're trying to do some like muscle tension with it to kind of release. You definitely don't want that consistent. But when you're trying to relieve pain, get the nerve to calm down, get inflammation out, constant stimulation is great. And then we don't want it too strong. I always say strong but comfortable. So I don't want your muscles doing this in this. We're not working the muscle, trying to get them to calm down. There is instances for that. Either one, you like that and it feels good. Two, when the muscle is really just holding on, that usually kind of gets it to calm down. But for the general, we're going to say consistent, strong but comfortable, and not where your muscles are tense. So how am I going to use this on my shoulder today? So depends on where the pain is. So what I like to say, if your pain is here, you want to put the stem around it. So you want the most painful part to be in the center of these stem pads. So I'm going to make sure I have the right lead here. And how do you know that? Each wire has a red and a black lead to it. That is going to be your opposite poles. So you want to make sure each have a red and a black. So you want to make sure that you're using the same lead that's going to one of your things. It's going to one of the connections, and you usually have 2 connections per TENS unit that you can get. So right now my problem is in the back. So I'm going to try to put one of these leads far back here. So it's out about right here on the shoulder blade. If I needed to go further back, I could, but my pain comes across. So a lot of my pain's in this posterior side. So I'm trying to go through this zone here. So a lot of my pain's here. So they're going to travel from here to here. I can take this other set because again, a lot of my pain is up here. I'm going to come on top of that. And then I'm going to come up here, which is about right here. So I have these 2 and then I have these 2. So I have 2 lines like that. I'm going to turn it up to where it's strong but comfortable, and I'll let it go for about 15 minutes. You can't really overuse this. I wouldn't use it consistently. I'd let it run its cycle and kind of take some time off. If you're having pain, like we talked about last time, like all down here is tender, I could go from here to here and stem this. If this is tender, I can go from the top to the bottom, can go sideways, anywhere that I feel like there's pain. But for now, we're going to do these 2 areas, let it go, and let me know if you have any questions on areas that maybe you're trying to use yours, and I can help you know where to place them.